worrying for parents. Cases of RSV are rising at an alarming rate across the country right now, including right here in San Diego.
The common respiratory virus can be serious in older adults and babies. CBS 8's Kelly Hessedal joins us live from Rady Children's Hospital with what you need to know. Kelly.
That's right. You know, normally we don't see a surge of RSV until December, January. Now we're seeing a surge in October. In the past week and a half, about 300 patients have tested positive for RSV here at Rady Children's Hospital. 20 to 30 patients are in the ICU, and the most vulnerable are babies under the age of 1.
Babies tend to get it worse than older kids. First of all, because they've never been exposed to this virus before. Other older kids and adults have probably seen this virus before, and they have some immunity. Babies also have much smaller airways, and the way this virus works, it affects the small airways that go down into the lungs. It causes a lot of inflammation, a lot of mucus accumulation.
And that is Dr. Alice Pong, the clinical director of infectious diseases here at Rady Children's Hospital. And she says there are so many cases out there right now that it's overwhelming medical facilities. Doctors' offices are full. Urgent care is very busy. Emergency departments are busy as well. Now, according to the CDC, cases have more than doubled in 25 states over the last month. It's unclear exactly why the surge is happening earlier, but experts speculate it could be related to the pandemic. You know, everyone was apart for a couple of years. Kids' immune systems took a holiday, and now that people are back together, viruses are spreading. Now, most kids over the age of 1 will have mild symptoms. The more serious ones to look out for are if your child has difficulty breathing or difficulty eating. That's when you should contact your pediatrician and possibly even bring your child into the hospital. Dr. Pong says at this point the virus is behaving exactly the way it does every year. So my question was, should parents change their day-to-day activities with their kids?
So I think parents need to use some discretion. This virus typically affects young infants. So the older kids, it's not going to be as bad. But, you know, take precautions. If there's a large crowd, you might want to take your kid there with a mask. You might want to steer away from large packed in places, especially indoors.
So she says the same lessons that we learned during COVID, such as, you know, as she just mentioned, avoiding crowded places indoors, also just washing your hands regularly, and certainly if your kids show any symptoms of being sick, keep them at home. Heather and Carlo.
Kelly, are there any treatments or medications that parents can give their child if they do in fact have RSV?
Yeah, there actually are no treatments for RSV, but your average healthy child will probably recover in just a few days from it. Meanwhile, though, if your child is experiencing some very mild symptoms like a low-grade fever or runny nose, Dr. Pong says your best bet is just to keep them at home rather than bringing them into the doctor's office or the hospital.
Not fun for any of those parents or the people working in the hospital. Very busy with that right now. Kelly Hessedal reporting live for us. Thanks, Kelly.
You think of something like that more toward the winter time, and here we are with our weather and still dealing with these types of viruses.
Just a huge surge.
Yeah.